What if we could help you save your knees, prevent you from having to take drugs, and prevent you from having surgery? Would that be something that interests you? My name is Dr. Kace Groff, owner, clinic director over at Navigate Health and Wellness right here in Tampa. This is something that is super important for us to have this conversation about today because so many people rely on drugs and medications, and ultimately, we're not addressing the actual cause of the problem. What we're doing is we're just masking the symptoms. And at some point, we have to say, when is enough? When is it too much that we are consistently taking 100, 200, 500, 800 milligrams of Tylenol, muscle relaxers, or over-the-counter medications that are really not doing anything except just helping us temporarily feel better. Now, if this is you, I totally get it. There's a time and a place. And maybe this webinar today is going to help shape your focus to understand what other alternative routes are out there for you. And if so, awesome. That's exactly what I do every single day in my practice, is help educate people and know what got them to this place. So that way we don't repeat history and go back down that same dark road of, chronic problem after chronic problem that leaves you in this rut of no solution, no answers, and feeling frustrated. And not only frustrated with the problem, but frustrated with the healthcare industry. And all too often, this is something that I commonly see in our practice. So we want to defy all the odds. We want to break this down for you guys today so that way you can understand what options you have in place. For me, my background is chiropractic, but over the last 10 years, we've really done a deep dive into the history of the knee, how the biomechanics and the physiology work with it, and that's really where my background comes from. If your pelvis, your hips, which is the main foundation of our body and our lower extremity, if that for any reason is rotated, shifted, or off balance, everything below it is going to respond to that. So does it make sense that if the hips are rotated, or maybe you've been having some of those hip issues and lower back problems, maybe even not, that the knees can actually become a secondary issue to that and break down faster? This is where people experience a lot of the knee arthritis, the knee degeneration, and end up having to go in for a scope, some sort of minor surgery where they clean out the knee joint, or even catastrophic surgeries like a knee replacement or partial or full knee replacements. The crazy thing is when we look at the cost of what it would be to take care of ourselves before we get to that point, it's maybe a few $100s a month, maybe a few $1,000s up front if you let it go, too long where there is minimal damage incline. But if you look at what the average cost of a knee replacement is right now in the United States of America, you are looking at around $60,000 per knee. And yes, your insurance may cover part, but what they don't cover is your quality of life. Take into effect how long it's going to take you to have to do rehab after that surgery, the time it's going to take you to have to learn how to walk again, sit, stand, get in a vehicle, move around, bend down, stand up. There's so many things that we have to take into consideration as what's the cost of our time and our health right now versus waiting for it to break down so far that we're finally left with a price tag A or B, and it's a lot higher, and that recovery time is going to take a lot longer. But the most important thing that you have to consider is it totally changeable? And what I mean by that is, have we let it go so far where the damage has been built up so much that we actually won't even see reversible change? Now, my program has a 96% success rate, and this is done without drugs and without surgery. We do have some at-home protocols, which get a very effective success rate as well. And some of the things that we provide here for at home, we can start with, exercises and stretches that are specific for increasing the flexion and extension of the knees. We also have some temporary topical creams that can help take away some of the muscular strain that, again, you're probably feeling when you're sitting or standing, maybe even laying down and trying to sleep at night, which can be definitely affected. But ultimately, we need to look to the problem and really find out what is the cause of this, not what is just temporarily flaring it up. If we can get to the bottom of this, then we can actually help you save your knees and save you from having to go under the knife with a potential outcome that's positive or a potential outcome that's negative. So you get to make that decision. Is it something that you're looking to take care of before it gets to that point? Or are you really set in the fact that drugs and surgery are going to get you to where you want to be? Ultimately, that's the question you need to ask yourself. If you're proactive, if you value your health, and if you're looking for a better solution, then I think maybe it's time that we jump on a phone call. I look forward to seeing you soon and get your knees back on track to living a healthier life.